Hello, and welcome to Common Health from the Virginia Community Healthcare Association, or VCHA, or what we're also known as is VACHA. I'm Tracy Douglas, VACHA's Chief Executive Officer. On Common Health, we're amplifying the voices of community health, both those who give care and those who need it. And today we are bringing a fabulous show to you all. And we've got a wonderful guest here, which I'm very excited about. Well, I'm always excited about the guests that we bring here because at the end of the day, I know many of our guests, either by way of a business affiliation or in some kind of meeting or just crossing paths. But I must tell you that the individual that we have here today is someone who I admire. She is doing some amazing things at a community health center here in Danville, Virginia, and her name is Marsha Mendenhall, and she is the CEO over at Piedmont Access to Health Services. We call them PATHS for short. Here in the federally qualified health center space, we like to use a lot of acronyms, and so Marsha oversees a health center that has many locations here in the Commonwealth of Virginia, and we refer to them often as PATHS. So welcome, Marsha, and thank you for taking some time to join us today.
Thank you, Tracy. I'm really glad to be here and to talk about this side of Virginia people don't always hear about. We're right above the North Carolina border, South Central Virginia. So I'm excited to join you.
And you know what, Marsha? That's really how I want to start this show before we get into speaking about the topic for the day. But you are I've been to visit your health center. I've been to Danville, and that's only one of your locations, by the way. And so what I really want you to do is, can you share with our audience about Danville? Talk to us about where you're located. Tell us about the wonderful people and the communities that you serve. Tell us what's there in Danville so that our listeners, whenever they're here in Virginia or living in Virginia and they're looking for something to do, tell us more about what it is that they could experience in the Danville area.
Well, we are in Danville. Danville is we have the Dan River that comes through Danville. So there's a few river activities, not a lot. We do more events like walking beside the river rather than being in the river. But we also have the city of Martinsville, which is much like Danville. They're small cities, but they have inner city problems. So it's a real collection. Populations there. Then the rest of our area is really rural. Chatham, Virginia, which is our county seat of Pennsylvania County, which is the biggest county in Virginia. So it stretches 60 miles up at least. Well, actually a little bit more than that in the wide. We also have South Boston, which is a town located in Henry County. It is a small town with a lot of rural areas. And then we have Boynton, Virginia, which is very rural, and it's the most east of our sites. And there's a big lake down there, and the Virginia side of it's called Bug Island. They tried to change it one time, the name, because they didn't want people to think it was full of bugs. So, but it's sort of stuck. And it's actually connected to a huge lake down in North Carolina that is rural too, but it's a pretty big water mass for the area. But we are rural. When NAFTA was enacted, and Martinsville had furniture and textiles, Danville had textiles and tobacco, and then all our other areas had tobacco. So it hit this area very hard financially, economically, and it's been a slow build since the early 2000s. Tooltex was a large textile firm in Martinsville, Henry County, and they closed in one day, and 8,000 people were unemployed in a not that populated of an area. And Danville followed the same suit with Dan River Mills, but tobacco got hit hard for a while too. The warehouses, we were known for starting the system of auctioneering for tobacco, and that all went away. So it's been a concentrated effort in each one of the areas to recover, and that doesn't happen overnight.
Mm-hmm.
Danville, which is the largest populated area that we serve, has started to do a lot of riverfront activities. A lot of the old warehouses have been turned into modern lofts and apartments, and it's really created quite an atmosphere down on our river that we didn't have before. Nice restaurants coming in, just activities. We used to never see kayaking on our river, but you do see it once in a while here. There's some people that do it. Martinsville also has experienced a lot of the same program. And what these two cities have in common is that we had nonprofit hospitals that really had been built by the citizens of the area that got sold to a private hospital system. That changed healthcare a great deal in our areas because, they're really a lot about the bottom line.
Yes.
And so forth. But we had so many people that were uninsured all of a sudden at once that when PAV started, which originally was Martinsville and Danville, they were 80% uninsured patients.
Wow.
It was, I don't even know how PAVs made it through all those years, but they did. And today we're down to 8 to 9% each month of uninsured. And that's because we went out and above the way to capture everybody that was uninsured and line up appointments with our outreach people, our community health workers, our medical staff, anybody, patient navigators, anybody we could. And we enrolled 5,000 patients into Medicaid. And it's made a big difference for our agency by far. We've been able to update buildings, buy buildings, and renovate.
So, Marsha, why do you do what you do? You have outside of you sharing a little bit with our audience, some things that folks can do to experience Danville, but certainly the communities there have been challenged in the past. I'm sure many folks, when the jobs went away, many people disappeared from the communities. But you live in those communities, and that's the community. And I'm curious, why are you doing what you do? It's challenge, heading up paths. But why your interest? I certainly think that you could probably go. I believe, because I know you, you've got a lot to offer, but why are you doing what you're doing over at PASS?
Well, so you can get in a personal testimony now. I graduated from high school in 1972. And during the 70s, 60s and 70s, there were a lot of things going on culturally, socially, and so many people came out of that era looking for what fulfilled their soul. It wasn't always about the money. You got to have the money to live, of course, and you don't want to live in poverty. But I came here as an intern with Danville Parks and Recreation, got a full-time job working in a low-income neighborhood as a community center director, started coaching kids, showing them that there were other things that they could do, and utilizing that athletic ability that they had, which really there were so many kids here that are such athletes that can provide a path to education. And I've always believed that education is the tool that every individual should not shortchange themselves in. I used to, and if you don't have that dream coming up, I grew up in a family where you were going to college the day you were born. Most kids have no concept that they could ever do that. It's changed a little bit with a lot of the financial aid and things available now. But back then, let's use basketball and get college scholarships. And a lot of the girls I worked with got them. And then I ended up coaching a boys team because nobody wanted to come over to the Salvation Army and coach those boys until they all grew to be 6'6" to 6'8". And then everybody came there trying to get the boy.
Right.
But it's just a thing within me that I just need to fulfill. And I'm thankful for that. I believe that as a steward of a nonprofit that provides such a valuable service, that we need to look at our community, see what they need, and try our best to meet those needs.
Wow.
So it's a lifelong thing for me. And I'm thankful, really thankful for that path.
And with that, Marsha, what are some of those services that you provide there at PASS to your communities?
Well, besides primary health care, we did go into OBGYN services also. We're finding that 80% of our women are not only on Medicaid, but also high risk for many different factors. That's been real important. And that's a real hard position to get into. We just got into it 3 years ago. Very difficult to do in a community such as this. We don't have a lot of OB doctors flocking to our neighborhoods. So.
Yes.
But we have a great staff doing that. We also community health worker grant from Danville Regional Foundation so that they can work one-on-one with homeless patients that can't control whatever chronic condition that they have, whether it be diabetes or hypertension. We do dental. We've done a lot of dental. We now have 5 pharmacies. And that's another thing. The 340B program has been very important to us because it allows us to have revenue that keeps OB running, that keeps dental running, and that keeps us keeping our equipment up, building a building. We're building one in South Boston right now, and we're going to add dental down to that. Mental health is an issue. I don't know that we could have enough licensed clinical social workers. Especially now, and going into the school system, the schools want behavioral health, mental health counseling, and we went from one LCSW to now we have a whole staff and many vacancies. We've got 3 psychiatric nurse practitioners and a psychiatrist on staff.
Wow. Really, Marsha?
Yes, we've just been lucky enough. When we hired a psychiatrist to do oversight on our psychiatric nurse practitioners, and we'd every month say, "Sure you don't want to come and work with us?"
Right.
And he finally said, "I think I do." That's been a real gift.
It's been a gift to that community because we know many folks are not getting into the specialty of psychiatry, and because it's changed over the years. I've been in healthcare for a long time, and psychiatry has just evolved to where it is today. And we don't see a lot of individuals making the decision to get into psychiatry. So for you to be able to have that right there in your community and as rural as you describe it to be is definitely it's a coup, I think. And I think that's just great that you're able to bring that to the community that you serve. And what are you seeing as far as the mental health challenges, especially in the school systems? What are you seeing? What are you experiencing? What are the communities going through right now with it?
Well, we have meetings with 2 of the school systems this week, and that's going to be probably a real point of discussion. Anxiety. A lot of kids are trying to be homeschooled for many reasons.
Really?
And that's not always good when you have social problems anyway, but I think that with social media, that's creating problems with bullying. It's anxiety is at all-time heights. We didn't grow up. When I grew up, it was the Vietnam War, but it wasn't on our back steps. COVID has affected every single person. And it also pulled a lot of the socialization that kids need from them for a year and a half. I mean, everything just shut down out of fear, and that's translated to the kids that can't always process that information. So we see a lot of that also.
So, audience, reason why we're bringing this show to you all and why we've asked Marsha to come and be available to us to speak is actually specific to what Marsha just shared with us with regards to what the school systems are experiencing in the communities that Paths is located. And we all know, and we've heard out in the press about the mental health need, especially in our schools. One of the things that has happened with Paths is that they were able to apply and be awarded from the Department of Health and Human Services through Health Resources and Services Administration. HRSA is what we call them. They were one of many recipients throughout the country that were awarded grants to open up access to behavioral health and other services that federally qualified health centers provide to schools. And it's what we call school-based health services. And so PATH, we're fortunate here in the Commonwealth that PATH is one of those health centers nationwide that got awarded one of these grants. And so Marsha, that being said, when you all discovered that you had been awarded, of course, you all had to do an application to receive that award. What did you tell the feds that you were going to do with this money if you got awarded? What's the game plan here?
Well, fortunately, we had a game plan already. In the city of Danville, we went from one of the bigger high schools in the nation. In the state, not the nation, in the state, they won awards every year for many things between band, sports, literary magazine, their school book annual and everything. It was just really a good school. And with the loss of jobs and population, when I came here, the population of Danville was probably around 60,000. It's now at 42,000. That's how shut down so many factories hurt. So the school system had gone down some too. It had lost a lot of their student population. It had become a minority school, which I dare say that the population of the school system in Danville is probably 80% Medicaid. Of course, COVID also what's gone up a little bit of teenage pregnancies. They're not overwhelming, but they are there. And then we also had worked on Pennsylvania County Schools, which is the rural county that surrounds the city of Danville. And it's agricultural and a lot of land mass and everything. So I had two different school systems with different needs. We got a grant. We were part of a big grant to hire 6 staff members for community health workers and their lead from the Danville Regional Foundation. And we were part of, there was another group that had 4 community health workers, and it was to cover, this Danville Regional Foundation was formed from the sale of the hospital. So it's one of the richest foundations of, probably in the nation from all that money. And of course, one of the initiatives was the health care. So from that grant, they put in it to explore community health centers. And at first we looked at public housing, and we visited public housing clinic and looked at that. It was a community group of us doing it. And from there, and this is all pre-COVID, so we've been on, it's not a fast track for us. Yep. It's been a long track. We also decided maybe it'd be better to do school-based health centers. So we went to Cincinnati. There was a group of about 15 of us that went there. And we went into 2 different, they had a rural one and they had one that was in a school within the city of Cincinnati. And both of them, that sort of fit what we were looking at also. And we came back from that, decided that a mobile unit would work better for Pennsylvania County schools that would rotate around providing dental, medical, and behavioral health. But in the city of Danville, there was space in the buildings because how many students had left the area. And they gave me a wing to in the vocational building at the high school, George Washington High School. And in that wing, which we have just finished renovations last spring, we will have two dental chairs. Well, we have 2 dental chairs, 3 medical chairs, 2 behavioral health rooms, and we have the space for vision. And I saw that I'd never thought about doing vision until I saw it in Cincinnati, and they explained the need that was there, especially with Medicaid students. So if anybody has a doctor for my vision center, let me know. That's the only thing that's holding us back. But so it's 2 ways to do school-based. But fortunately for the foundation, when they took us to these places to see these centers, that enabled us and the school system to actually have a real life vision of what this looks like and the possibilities. Because we saw 2 centers that were booming. Where it was family medicine coming in. The social worker with Danville Public Schools at that time that they had assigned to it was so gung-ho about it that she did a lot, but then during COVID, she left. She's gone to another school system. So we've done a lot in 5 years of changing and trying to get to the part where we're doing. The mobile unit, we started off with dental. We were fortunate enough to hire a dentist that used to be our public health dentist. We had that in Pennsylvania County and in the city of Danville, where a mobile unit went around and set up for dental at each school, stayed there a couple of weeks, saw all the kids for dental, and then picked up and moved to another school. So that was the most easy service for us to get in because parents had already been through that if they were from Pennsylvania County in Danville. So we started that last March. You have to work around school schedules, but we were managed to get in about 80 kids for dental before we got into SOL. You know, we can't interfere with SOLs. We close the school. Danville and Pennsylvania County actually start school like August the 9th, and they get out the middle of May, so it's a different school schedule. But we worked through those. How's it going to look like? How do we work with the school to get the kids out? But our initial, when we sent applications out, we got 300 back to start with for dental alone. At Danville, we went to the athletic coaches first and the vice principal, been working on it. So we just finished up in about 4 days. We did 70 sports physicals for the kids. So we're getting there. You know, it's moving.
So how did the word get out that these schools were going to have the opportunity to actually have comprehensive healthcare services in their locations?
Well, starting with Pennsylvania County, Chatham being the county seat, they have a little weekly newspaper called Star Tribune. So that reporter caught hold of the story through our presentation to the school board. Because first you got to convince the school board and the school personnel that you want to do this service, and they got to be on board. So we presented, what we're going to do. COVID hit. That slowed down all that progress. But stories were going out periodically. When the COVID money came out and you could buy a mobile unit, we latched onto that, went and purchased the mobile unit for Pennsylvania County schools, which what it did first was COVID vaccinations and community events. And so for a year and a half, we went out and did that. But we had it equipped with a dental chair, a medical chair, and a place for the office or behavioral health. And I got lucky enough to get a driver for the mobile unit that used to be the front desk for the Air Force. He was in the Air Force for their healthcare services.
Lovely.
So he gets to double up.
Awesome.
But it was that process of going. Then school nurses. You have to make sure school nurses understand that we need them, that they're the liaison between the parent, the school administration, and getting them to us. They're very important. And so that's the Pennsylvania County nurses met with us. They went with us when we went to the National School-Based Alliance Conference. They saw how it built in. Some of the school administration went. They saw how behavioral health worked with it. Then we had a big team from Pennsylvania County go, principals, nurses, school administration, and they were sold on it.
Mm-hmm.
So the first things we did for Pennsylvania County schools and Danville too is we went to schools and did vaccinations for staff and kids.
Wow.
And now the health department had been doing a lot of it, but their resources started running out. So we were doing the backup for all of that. And then when school was actually coming back in session, and they've got so many kids that hadn't been vaccinated or behind,
mm-hmm.
we scheduled a day in each of the 4 school zones where parents could bring their kids in and get updated vaccinations.
Mm. So
Danville's been a little different. We're on our 3rd principal at the high school, but they've all been behind the project. And the gentleman that's just joining, in fact, we have our meeting tomorrow on it, we've talked, and he's really behind school base. And he's for whole family, etc. So it's exciting that we can do that. And that being a standalone site, my predecessor at PAVS, and I have followed up in the same thought, is you provide, why should someone, because they don't have the money that other people have, not have great facilities? And so we have built a really top-notch center over there, and the security is high on it. The soundproofing, we've done as much as we can. So because we don't want one student to take anything back to another student.
Right.
So, we've got a small conference room in there. We want to do some education for kids. Mm-hmm. So I really believe that these 2 approaches are different, but they do address what is possible in 2 different types of school settings.
Yes. Yes. It's very interesting you say that because, growing up, right, we just always had the school nurse, and that still kind of carried into where we are today, too. So when I had learned about your school-based health center, and the idea that you had gotten this award, et cetera, but that you had been doing this for a while. I mean, what a great concept, right? And then the fact that you've gone into another state, and that we also have other health centers in other states doing this as well. That said, I can imagine how you would have to show that this is really a partnership, right? This is really a partnership with the school system, with the school administrator of the school and the nursing team and all that. How have the teachers been? I mean, have you gotten any feedback or responses from your teachers there? Are they in support of this? I mean, how do you work with the teachers in that respect?
That is we don't often see the teachers. Who we see are the principals. We see the school nurses, and then we might see the teachers that really push for the program. You do have students and teachers that are advocates, and that helps the most in getting the program really done. We have interns this summer from George Washington High School who hope to go into healthcare when they get out of high school and go to college and everything. Very smart young ladies. When we got ready to do the physicals, we were not getting as much as when these girls called these kids that they knew and said, hey, you got to get your physical. And a couple of the girls were in sports themselves, so they helped to process it. And then the kids like, oh, okay, I'll come, because these girls had promoted. So from these interns, we are hoping to form that student alliance group that helps promote, be at football games, to give things out, and so forth. With the teachers we went to at Danville, Pennsylvania County is a lot harder because they have 4 big high schools. Danville only has the one. Well, they have 2 actually. We went to the opening of school, the week of school, where the teachers are the only ones back so far, and the administration. We went to one of their teachers' meetings, and we gave out a little gift bag with some COVID wipes and a mask, and our little dental packs and information, and gave that to a water jug, everything we could, and gave that to them, a little bag of goodies. We're going to follow up this year where during that week, when they get a moment, come visit us, let us walk you through our site, and you can pick up a little gift then.
Awesome.
So that's where we see the teachers. I think that they generally are acceptive of it. They just haven't been fully educated on it.
Mm-hmm. Right.
Yeah.
Well, hopefully we have some of those teachers listening to you on this podcast and getting excited about some of the things that you're sharing. And Marsha, what do you see for the future of school-based health services?
I think that I'd hope to see something that's really busy and the kids are utilizing, that their parents come with them when need be, that we really take care of vision problems of all the grades. That's what I see for it. But the bottom line is this: our health indicators for this area, out of 133 jurisdictions, and I'm talking about the oldest, the one I've seen. We've got a new one getting ready to come out. I don't know how it to be, but overall, the city of Danville was like 129th out of 133. Pennsylvania County was a little better, but still not where it should be. So what that says to me is health education from the day you're born to the day you become a parent, and all the way up to you becoming a senior citizen is very important. And until you really educated on all of these things, your health won't be the best that it is. We have high rates of diabetes. We have, like I said before, 80% of our OB patients are at high risk. And that's because of lack of prenatal care. And it's surprising how many people show up at the hospital to deliver a baby.
Yes.
Not being seen. The hypertension, lung diseases, it's just a lot. And if you know better, then you do better. So we've got to start at a younger age, not when you become diabetic. We've got to say to these kids, how many of you have a diabetic relative that's lost a leg? How many are blind because of diabetes? And that goes back to my recreation days. I was in charge of a blind bowling group that we met once a week. And of course, I had to go around and pick up all these people. So out of that group of 12, there was only one that was born blind. The rest of them were diabetic. So let's get to a place where you're not battling diabetes. You're not battling hypertension, or at least as much as we can control it. But you got to start young.
And I think I think you've hit the nail on the head. And we commend you here at Common Health for wanting to take on the challenge of addressing the indicators, right? The clinical indicators, and wanting to start so young, right? And you're in the high school. We all know our teenagers, right? And we love our teenagers. But at the end of the day, it's a hard age group. And to hear you partnering up with some of the young ladies, right, that help to bring kind of functioning as outreach workers and really touching their friendships, and then how that kind of trickled out and getting the word out and getting those kids in. So thank you for all that you and your team is doing, and bravo to everyone on your side doing what you're doing. Marsha, I want to end this by saying, I know you said it very eloquently about being able for us to get at and take care of ourselves. But what is it at the end of the day that we can say to your community and to other people who may be listening to this podcast? What is it that we can do in our communities to help you, PATHS, your organization, and other organizations like yours that are in these schools, and also doing outside of the schools? What is it that we can say to help you and bring other folks to help support you and lift up your organization so that you can achieve what you're striving to set out to do?
Well, just being open to the concept. We still fight at federally qualified health centers that we're a free clinic, and we all know that we're not, that we're just making healthcare equitable and available to anyone that needs it, that just to support us, whether it's through you using our centers ourselves,
Mm-hmm.
or whether it is telling everyone about us. I think that's the biggest thing. We strive to be the best we can be, but it's always a work in progress. So just any way you want to help us.
I think with that being said, if I could just end this also with what you're saying is that, and I've told people this, is that we are community health centers, and the key here is community. Mm-hmm. Anybody can come to PATHS and other community health centers, no matter what their ability to pay is, because you know what? At the end of the day, we're just as good as every other practice out there. We have MDs and DOs and nurse practitioners and physician assistants and RNs and medical assistants. We have that too. So at the end of the day, what you're doing and what other folks are doing, truly, you're making a difference with some of the same resources, right, that you might see in other settings. So with that, audience, I do want to say thank you for listening. Again, we are very excited that Marsha Mendenhall from Piedmont Access Health Services there in Danville has agreed to come and talk with us a little bit of all the good work that they're doing there. But also, audience, know that federally qualified health centers, we just aren't out there in buildings, but we are also in your schools. So anything that you can do to help promote and possibly get a community health center into your school system, please inquire about that from your local health department or even your state health department. So Marsha, thank you. And we bow down to you. I want to thank my guests for joining us today. And thank you to all the listeners for tuning in to Common Health, brought to you by the Virginia Community Healthcare Association. If you enjoyed this episode and you'd like to help support Common Health, I encourage you to hit the subscribe button, share it with others on social media, leave a rating and review, or visit our website at www.vcha.org. This is Tracy Douglas. Thanks again, and I'll see you next time.